Okay, so now we're going to move to the actual vectored lift on this side, so that we're treating like we've treated internally. Now we're going to treat externally this lower face. The vectors along these lines right here are perpendicular to the facial tension lines. And if we can tighten those up, then we can lift that face a little bit, maybe get rid of a little bit of the jowling and tighten up the entire face, including the mid-face. So the vector is along this line. Now, as an increase in the probability of great results, instead of just generally preheating, which is what most people do, I have developed a protocol where you're going to preheat along the vectored lines, which is even better because it tightens those bundles a little bit better. So I'm envisioning at this point a vector from the tragus of the ear all the way down to the mentalis area, in this area here, just medial to the marionette lines, and then another one here, and another one here, and another one here, and another one here, going past the nasolabial folds in this region. All these pulling in that vector direction. Okay, here we go. Now, when we get ready to use the actual stacked vectors, we don't come off the line. Here, we're just generally trying to get all the tissue heated, but we're still doing it along the vectored lines, like this. Whereas when we get ready to do the other one, and I'll explain to you, we actually stay dead on the vectored line for a series of passes like I'm doing now, and we'll do that. But right now, we're just interested in putting about 3,600 joules of energy into this tissue. And that's 2,200, so that should be right at what we're looking for. All right, so now we're going to go to the next step, which is, it says preheat the vectors. Now this is 5 paints with 3 rounds, 1 double stack. So we'll start here. That's one, 2, 3, 4. Is that too hot? 5. Next vector. 1. Okay, so that's 3 rounds. And then we would do a double stack. And it's done exactly the same. You don't have to change anything. You just hold it down for the 2 count and go to the next point. Second double stack. I'll do 2. That's 2 double stacks. We go to the next step, which is the vectors, 4 stack for 3 rounds, okay? And using the PSO4 handpiece, we have this little device we added here to keep the tissue cool. It works exceptionally well because that's the #1 creative issue for having some discomfort on the skin. If we can keep it cool, it doesn't. Now this is a low setting because it stacks the pulses and goes deeper and deeper into the tissue. So here's, you'll see it just barely depresses the skin, and that's what you want. Okay, Miss Kelly, you tell me if you need more air already. You can even do the lower eye without the discomfort. See that? Second round. It's not something you can sit down and do in 30 minutes. To do a lower face or just a lower face and a brow lift take you at least an hour if you're just moving at the right speed. So here we're going to do a final step in the vector lifting.